You already know how to write a note, but you might want some extra details about the notes you'll see in the ICU. Let's quickly go over the types of notes you'll be writing and a few things to keep in mind to make your notes as efficient and effective as possible. Most of your notes will fall into one of three categories: the daily progress note, the accept note, and procedure notes. Let's talk about our daily progress notes first. The SAICU note template can be found in the Notes tab on Cerner. We're only going to focus on the parts that make our note different from your typical SOAP note. Our progress note starts with a critical illness score. There are lots of different scores to choose from, but we use a SOFA score for just about every patient. You can add a different score if you think it's relevant, like a MELD for a patient with liver failure. Your score lets us know not only what we should be worried about, but how worried we should be. The hospital course functions as both our sign-out and as a discharge summary when our patients are ready to leave the unit. This is where we keep track of all the studies, surgeries, interventions, and even our main concerns. It's a great tool for continuity. If you were on call alone in the unit, and it's something you would want to know, make sure it gets into this section. Objective data is pretty much what you'd expect. On top of the normal stuff, we emphasize fluid balance with weights or ins and outs, ventilator settings and infusion rates, and the overall trends for our lab values. A quick word on medications, especially for those of you not familiar with Cerner. Medication orders automatically populate in our template, but to see if any PRNs were given, you have to go to the MAR Summary tab. The assessment and plan is where you bring it all together. Start with a succinct description of who your patient is, why he or she is in the unit, and the major issues you're concerned about. A typical assessment might be, Ms. X is a 72-year-old woman who is day 6 post-hemicolectomy for colon cancer. 2 days ago, she was upgraded to the ICU for respiratory failure due to hospital-acquired pneumonia. Her stay has been complicated by atrial fibrillation, ARDS, and C. diff colitis. Now organize the patient's issues into systems. For each system, write the patient's problems and then what you're doing about it. Remember, an issue doesn't always have to be an abnormality. Sometimes you're monitoring a patient so that they don't develop abnormalities, like watching serial hematocrits after surgery to make sure they stay normal. If that's what you're doing, give yourself credit for that in your note. When I'm done with my plan, I like to check to make sure all the medications I listed are accounted for in the medication orders. Some medications have expiration dates and fall off, and it's very easy to miss, so an extra check here keeps your patient a little bit safer. One more thing before we move on to the other notes. ICU notes are really long and can be pretty labor-intensive, so sometimes we copy and paste the things that don't change from day to day. Be careful when you do this. It's very easy to copy over outdated or incorrect information. If you don't have time to check what you copied, it's better to not document anything. The ICU accept note starts with the same template we used for the progress note, but you have to make a couple of changes. If it's a direct admission, change the title to Anesthesia H&P. If the patient is being upgraded, the title should say Anesthesia ICU Accept Note. Include a past medical and surgical history, a social history, and the patient's home medications. If this information is already in the EMR, use the stamp icon to find problem lists, procedure histories, health habits, and home medications. Last, let's talk about documenting procedures. Occasionally, you'll do procedures like arterial lines, central lines, or even bronchoscopies. The procedure note can also be found in the Notes tab. Document your supervising attending, the indication, and then describe what you did. If you placed a central line, use the stamp icon to find the line insertion template. This exports your data to the nurse's tasks. Sometimes you'll be asked to provide a general anesthetic for a bedside procedure that another physician will be performing. To document your anesthetic, call the main desk at 8240 to add the patient to the OR schedule. Once the patient's added, you can open the anesthesia record from a computer in the patient's room and document it just like you would in the OR. That should be plenty of information to get you started writing great notes in the ICU. If you have any questions or ever want some feedback, ask your senior or your fellow. We'll be happy to help.